Do you frequently feel like your heart is pounding, even when you're just sitting down? Or maybe you've had a fever that just won't go away for days. Imagine being tired all the time, even after long sleep. These could be signs that something more serious is going on. Typhoid fever might be the reason. It's not just a simple fever, it's an illness that slowly takes over your body. It spreads easily, especially where clean water and good hygiene are hard to find. Have you ever traveled to a place and gotten really sick after drinking tap water? That could be typhoid. Let's find out how this happens and what you can do about it. Imagine someone doesn't wash their hands after using the toilet, then prepares food you eat. If that person carries a tiny germ called Salmonella typhi, it can jump into your body through that food or water. These bacteria are like sneaky invaders. They survive stomach acid, reach your gut, and then spread into your blood. Only humans carry this germ, so it spreads from person to person. Let's say your friend had typhoid, got better, but still carries the germ in their body. They might not feel sick, but could pass it to you through a sandwich they made. That's how it spreads silently. So the real cause: contaminated food, dirty water, or contact with carriers. How do you know if it's typhoid and not just the flu? Let's play detective. You start with a fever that rises slowly, maybe 101 degrees Fahrenheit at first, then 103 to 104 degrees Fahrenheit over days. You feel weak, have a bad stomach, maybe a headache like a tight band around your head. You lose your appetite, food looks unappetizing. After a few days, you might notice small pink spots on your chest or stomach. Your stomach gets bloated, and you alternate between diarrhea and constipation. Sounds confusing? Yes, that's why people often mistake it. Remember, high fever for over a week, belly pain, tiredness, and no hunger are the big clues. If this sounds familiar, especially after eating street food or drinking untreated water, get checked. So you feel really sick, what now? Can't we just take fever pills? Well, not so fast. Typhoid needs proof, not guesses. Doctors use blood, stool, or urine tests to find the Salmonella typhi germ. Imagine testing a water sample to find a single drop of ink. Same idea. The most common test is the Whittle test or blood culture. Once confirmed, treatment starts. Antibiotics are the main fix, like ciprofloxacin or azithromycin. These kill the bacteria. But here's a warning: don't self-medicate. Wrong antibiotics make the germ stronger. That's called resistance. Also, drink lots of clean water and rest. Severe cases, maybe hospital stay. After all, treating typhoid isn't quick. It takes 7 to 14 days to fully recover. So test first, then treat, just like a smart detective. Can we stop typhoid before it starts? Yes. Think of prevention like wearing a raincoat in the rain. First, get vaccinated. 2 vaccines are available, 1 shot or 4 pills. They are not 100%, but they lower risk, great for travelers. Second, be a food detective. Only eat hot, freshly cooked food. Avoid street salads or fruit you did not peel yourself. Third, drink safe water. Boil it, filter it, or choose sealed bottled water. And never skip hand washing, especially before eating or after the toilet. Imagine germs sticking to your hands like glitter, hard to remove without soap and water. Also, if someone in your house has typhoid, clean toilets often and keep their utensils separate. Prevention is like building a strong wall against the germ. New weapons are coming. Scientists are working hard. A big advance. New conjugate vaccines like TIP-RT-CV that work better in kids and give longer protection. Some places already use them in public health programs. Also, researchers are using smart tech, like tracking outbreaks with mobile data and GPS. Imagine getting alerts if typhoid is spreading near your town. Plus, studies are testing faster tests, like checking blood with a paper strip, like a pregnancy test. Exciting, yes. And global programs, like the WHO's initiative, are helping poor areas improve water and vaccines. So the future is hopeful: smarter vaccines, quicker tests, and cleaner water for all. One day, we might even wipe out typhoid, like we did with smallpox.